So we are recording the presentation to archive it online. Today's webinar is presented by Beto Plascencia, Cancer Screening Care Coordinator at Community Health Alliance in Reno. Beto, I'm going to go ahead and turn it over to you.
Okay. Hi, everybody. All right, so a little bit about Community Health Alliance. We are a nonprofit, tax-exempt organization in Northern Nevada. We are a federally qualified health center, and we provide medical, dental, behavioral health, as well as many additional services. We have 6 different locations throughout Northern Nevada. We have a location on Wells. We have one on Record Street. That's our Outreach Health Center. Neal Road Health Center in Sun Valley. Center for Complex Care in Crampton Street. And we recently opened one in Sparks. And all these are not included. The WIC is not included in that list. So our objectives for today is to identify a screening champion, identify the tactics essential to the success of screening for cancer, understanding barriers and challenges to implementing and sustaining cancer screening protocols, understand the benefits in cancer screening programs through a clinician's viewpoint. So what is a screening champion? A screening champion promotes the program's vision, values throughout the organization, and partners within the community. Someone who is respected and has credibility and is committed advocate for the program. Members of the organization must feel comfortable with reaching out to this person for questions or support. Will do what they say they will do, and will answer questions and find correct answers if they are unavailable to provide the correct responses. So being a champion does not mean you're going to have all the answers for everything they ask you. It's going to be being able to find those resources to give them the correct answer. And how do you become a champion within your organization? Somebody who has a personal interest in cancer and cancer screenings, someone who is motivated to seeing cancer screening improvement within organization and their community, someone willing to be spokesperson for cancer screening, someone willing to assist with training and follow-up training to staff within the organization, someone willing to work with others and setting up plans to promote cancer screening and committing to making sure all staff follows through with the plan. Someone focused in improvement and willing to adjust as the need changes within the organization, and willing to work with the community partners in achieving mutual training goals. What is the role of screening champion within a clinic? Point of contact for the staff regarding cancer screening, point of contact for patients or clients, motivating staff in the importance of screening, work with organization staff in developing a long-term plan and establishing goals to improve screenings within the organization, analyzing of results and sharing with organization, presenting and training on current screening guidelines, and development of cancer screening policies. The development of long-term plans and establishing goals long-term helps out because you do need to make sure you're giving your plan enough time to work itself out before you make any changes. So normally we try to develop those plans like at least for a year long before, so we can give it a few months to work itself out. The role of champion with patients, assist patients with barriers. This could be filling out applications, helping set up transportation, whether it's bus passes, getting them taxi, arranging appointments for the patients, this setting up colonoscopies, mammos, biopsies. A lot of times you're going to have a lot of language barriers. They won't be able to set up those appointments on their own if you don't assist them, and they may not have somebody at home. So it's important for you to reach out to those patients and make sure you can assist them with scheduling those appointments if needed. Providing education to patients on the benefits of getting screened for cancer, distributing kits. I always try to keep kits on hand to make sure the patient's walking out with a kit in hand. Reminding patients if test is not performed, so calling patients, sending patients letters, text or email if available within your facility, or in person, finding out when their next appointment is and going over and talking to them, and then tracking results and completion of test orders. Who should be involved in cancer screening? Every staff member that comes in contact with the patient should be involved. Your registration, check-in, medical assistants, your LPNs, RNs, providers, behavioral health, CHWs, care coordinators, call center, checkout. So anybody who comes in contact with that patient is an opportunity to offer or remind the patient of those screenings that they're either due for or have been ordered and have not completed. When should training take place? Initial new hire training, monthly reminders, so regular program updates or changes in guidelines. If any updates were to occur, just send them out, talk to the staff. Quarterly updates and annual training. You'll also have examples throughout the day to get a chance to talk to patients. Let's say they got ordered a Women's Health Connection or a Well Woman exam, and while you're filling out those applications or talking to them, that's an opportunity to see, oh wait, they missed maybe a fit test, and add that to that order so they can walk out with all the screenings in that single appointment. So your front office, that's your first opportunity to see if a patient is due for any screenings. If a patient asks for screenings, they can give them a brief description of the program. It's nice for them to know what you're offering or what services are within your clinic so they can answer a lot of those questions. If they do need any further explanation, they should know who the champion is within the organization so they can guide them to them. Have front office remind the patients of screening so they are able to ask their providers. Simple question as, when was the last time you had a Well Woman exam? Or make sure you ask your provider if you're due for any screenings so you can get that order in today's visit. Try to get those patients involved in their own health so they can ask the providers, oh, I may need this, or can you check if I need this? So if the provider forgets to order it, they can initiate that conversation. Your medical assistants, LPNs, RNs, those are your second person to come into contact with your patients, and they have the opportunity to remind the patient of outstanding screenings and they may be due for. So they'll be scrubbing the charts prior to the appointment so they can identify test results or review if any are needed. They can inform the patient of any programs available to assist with the cost of screening and remind providers to place orders for any screenings needed. You can also have them remind patients of any outstanding orders that they have not performed and remind them to make sure they complete them. And they can also assist with explaining tests and how they are performed. Perfect example is a fit test. It takes about 10 seconds to explain how a fit test is done at home. If they can explain that to the patient, that's one less thing the patient has to worry about reading those instructions and figuring out how to perform it at home. Providers, they review patient chart and place orders. They can discuss with patients benefits of screenings, discuss with patients screening options. They can explain the process of screening and ease patients' fear about screenings. answer questions regarding screenings or what screening works best for them, and provider recommending a screening will improve your compliance. If they can get that, the provider can get that buy-in, that relationship that they have with their provider can make the difference between them completing it or not being non-compliant. Behavioral health, if you have behavioral health within your organization, can assist with overcoming fear of getting screened, providing emotional support. They can also assist with finding the root cause of why a patient is non-compliant, and they can help identify patients who have not completed screenings. We tend to use behavioral health a lot for our non-compliant patients. A lot of times we don't know what the reason is for them being non-compliant. We've had several of them. The last one I can remember was a patient was non-compliant for almost a year. Every single appointment we would order screening mammo, order a screening mammo, order a screening mammo, and she refused to do it. And when we got her in with behavioral health, to talk to her about what's going on, what was going on for her not to complete that mammo, she was able to open up and say, her sister was going through chemotherapy for breast cancer, so she had a fear of getting screened because of what she saw her family member going through. So we were able to get her to see behavioral health to help support us to get that screening mammo. Your checkout, that's our last point of contact. So the last person the patients will see for their visits. They can assist with scheduling next wellness exam. Ask, I see you have not scheduled a well woman exam in a while. Would you like to schedule that right now? Direct patients to screening champion to answer any further questions. Do you have any questions you would like to ask our screening care coordinator? And patient has more chances of compliance if all questions are answered and they feel comfortable with the test. And they can remind patient that it is important to make sure all tests are done that were ordered that day. So just a simple remember to complete any order or screenings that were ordered during today's visit. So when you do have these patients going to checkout, you want them to be able to give them, if they have any last minute or last second question that they forgot to maybe ask the provider, that they can ask it right then, they can direct them to the correct person. So we have a question on behavioral health. The question was the patient referred to behavioral health to overcome the barrier via referral, or was this a brief conversation? We brought in behavioral health to assist us on figuring out why she was not compliant with her screenings. So with this particular patient, we couldn't find what the reasoning for her. She would not do it. She wouldn't say anything during. So we decided it would be a good idea to bring behavioral health within our organization. So we do have what we call warm handoffs. And as the provider exits, they bring in behavioral health and they introduce the behavioral health to the patient. And they were able to talk to her and get the reasons why she was non-compliant. Does that answer your question? Okay. Yeah, it's been working for us getting the behavioral health portion into it, even for the non-compliance patients. So the call center, the patient normally is already calling to schedule an appointment, so it only takes a few moments to ask to schedule their next wellness exam. They're already on the phone. It takes a couple seconds to find out, okay, they're due for another well woman exam, or they can also guide patients to programs to assist with services the patient is requesting. They can remind patients to have ordered tests done prior to their upcoming appointment, so provider can review them and they can set flags to remind medical team patient asked about screening services during their conversation, so they can answer the questions, that patient's questions. So that was just a simple setting up that reminder. So just in case the patient forgets that they were requesting colorectal cancer screening, if they document that, you have a higher chance for the provider to say, oh, during your phone call, you were talking about maybe getting a colonoscopy done or getting a fit test done, and that can initiate that, them to remember what they were talking to the call center about. So using your electronic medical records or EMR, use the tools within that are already built into the system to help you using the flags, the reports, reminders, internal messages. So in our system, this is what a reminder would look like. So we check for the completion and see if we need to call the patient or if they've already completed the test. These will pop up on a daily basis. You get to decide when it's going to activate or what you need to do with that. You can add additional comments in case you need to add, refer them to additional programs or additional questions you may need to ask. Your screening and preventions tab, this allows you to see what the patient is due for and what is coming up. So with this one, it's really good to be, if it's up to date, it works really, really well because it flags the providers and the MAs when they're scrubbing through those charts. Where we run issues is if they're not updating this as the results are coming in. So this is kind of works. If you stay on top of it, it's a really helpful tool. If you don't stay on top of it, it's not going to be a lot of assistance. So access to kits or orders during the appointment. Make sure patient walks out with screening order in hand. And patient's giving kits before leaving the office. So you don't want the last thing you want is a patient to come back and have to either pick up a kit again or pick up an order. If you can give it to them at that same appointment, you have a higher chance because they're not going to forget about it. They're not going to misplace that order or that kit. So you have also when you call them and remind them, they already have the kit in hand, so they have a higher chance of completing it because they already have the kit right with them. Have the patients give a verbal commitment to complete test. If not, if they can't commit to actually performing the test, they can discuss their concerns with a provider or the screening champion to see what's their barrier, why they're not confident they want to get that screening done. And make sure you provide the patient with the champion's contact information so they can call for any questions just in case anything comes up. So I like to keep like my business card at each one of our provider stations at check-in and check-out. So if a patient at any given time has any questions that they would like answered, they can always call me and I'll walk them through the fit test so they can perform it at home, or if they have any barriers, they can contact me directly. Clinical office tools, so videos demonstrating how the fit test is used, and decision aid tools and visual aids. Just ensure language sensitivity. If the MAs don't have time to explain how they're going to be performing that fit test, these videos help out a lot. I believe we've already sent out the videos. So there's 2 videos that explains both fit tests, so they just walks them step by step on exactly how they're going to perform it. That way they don't have any questions about it or that's one less excuse that they have to not performing that test. Things to ask during a reminder call. Call patients to remind them of incomplete screening order. Ask them what barriers they're having with completing the test, whether it's transportation, language, forms, Maybe they've lost their kit and they needed you to send a new one. They lost the order and need you to mail them a new order, or the cost. It's really important to find that exactly what's causing them not to complete it. We may have a program that maybe we forgot to enroll them in one of the programs, and the cost is way too high and they don't have that money the money to perform it. So finding out exactly what the barrier is. The language one, I find in our community, is a huge one. A lot of the times they won't tell anybody that they don't have anybody at home that can translate for them to set up an appointment. And that's where you would come in and be able to set that appointment up. It's something that simple as not having somebody to call and set up that appointment. Remind the patient of commitment to complete the test, and ask when they will complete the test so you can get the results. I like to get the verbal commitment from the patient on when they're going to complete it, and to give me a verbal that they are going to complete it. That way, the next time I do call them, I can tell them, remember you told me you were going to perform it, and I'm looking for the results and I can't find it. Makes it a little bit more personal, more one-on-one, so you can get them to complete those tests. Sending patients reminders through mail. The reminder of upcoming screening patients are due. Reminders to complete screenings ordered if patient is not responding to phone calls, or reach out to patients who you have not seen in a while. Use language and tone appropriate with population you're working with, and just be careful on this one with HIPAA to make sure you are allowed to send those reminders, or if they only want phone calls. So just check on your company's guidelines on mail. And using posters or reminders for patients so they can have screening in mind, and they can ask the provider. Again, this is going back to trying to get the patients involved for their own health and them asking the question. Simple questions as when was your last Pap HPV test? When was your last mammo? When were your last screened for colorectal cancer? Consider the placement of the posters to remind patients in the lobby, near registration, in check-in, near the scale, so while they're getting weighed, they're going to be looking at, they may need a Pap HPV, and trigger that question for when they get into that office. Near restrooms, if they got to do take a urine sample, they're going to be looking at that, or inside the patient room while they're waiting for the provider, they can read those and say, oh wait, I need to ask the provider when my next mammo is going to be, and in checkout. So again, this is going back to making sure they have that in mind in case they completely forgot to ask the provider, and they can get directed to the right resource. Track your progress. Run reports to see how many tests have been ordered versus how many have been completed. Don't get discouraged by the results, and don't be afraid to change things up. If they're not working, not all things are going to work with all patients, so just don't get discouraged. I remember coming into my position at Community Health Alliance, the first thing Dr. Crawford told me was to go by the 80-20 rule, is how he stated it. So 80%, go for 80%, and 20% assume that they're most likely not going to complete it. So you are going to have patients that no matter how hard you try, they're not going to complete the test. So don't get discouraged by it. Don't take it personal. Just go along with it. All right. Keep a spreadsheet to keep track of who you've contacted and who has already completed the test, and use population management tools if available within your organization. So we're starting to play with a program called Azaris. That's a population management that pretty much rolls all this into one and prints out a report for us to compare side by side. And working with community partners, find out what services are offered by our community partners. Work with community partners so you can reach a larger population. Example, working with like the Mammo Van. If you can get them at your location, we'll provide screening services near patients and also assist with costs. So that's two barriers right there with just working with the Mammo Van and getting them to your location. Really important to work with community partners to make sure, see what they have. Maybe they are offering something you may not, that as soon as you come across it, you can refer patients over to them. At the end of the day, we're all working for the same goal as a community. So it's not one versus the other. It's working together to make sure the patients get all the services they need. So summary to wrap everything up is identifying the champion within the organization, staying up to date with your guidelines, make sure you train staff and look for opportunity to improve, be a patient advocate. Not every system will work with every organization, so you're going to have to change it up. Don't be scared to changing it up, and what works for me won't work for everybody. Don't be afraid to test and fail until you find what works. Identify what is working and where improvements can be made. Identify patient barriers and how you can assist to overcome them. Set reminders. Get the whole organization to buy in, to work for one main goal. So get the whole organization to be on page to increase screening goals and why it's important to get those screening goals. Track your progress and collaborate with community partners to improve the health of our community. Any questions? So how can you get the Mammo Van to come to our clinic? Just give them a call. They're usually very upfront. Like I just reach out to them and see how their schedule's looking, or if they have any available openings that they would be interested in, maybe in that area of town where your facility is or your clinic is.
Beto, I'm going to jump in here and add a couple of things while we're waiting to see if anyone else has any questions. So we do have demonstration videos for the OC Auto and Insure Fit tests in English and in Spanish as part of the modules. So if you don't have those links, you can find them on the cancer screening page under healthcare providers. Those are really great resources, and we also have an informational video on what happens during and after a colonoscopy. So if you do have a patient that's going in for a screening or a diagnostic colonoscopy, that video is a really great way to show them visually what that experience entails. We're looking for similar videos that demonstrate mammogram and pap test. They might be like animated videos or something. But if we find something that is a great resource for our partners to use, we'll be sure to include that in the modules. And if you are looking to get the Mammo Van to come to your clinic location, we now have a phone number for you. You can give them a call at 1-877-581-6266. And they generally have a schedule that's booked out a couple months in advance. So if you call them with some advance notice, they can see if they're going to be in your area. The Mammo Van tends to stay in southern Nevada more during the winter months because it's difficult for them to travel if there's going to be snow. So for people in northern Nevada, consider looking at them more for spring, summer, early fall screening dates, because it's easier for them to get up to northern Nevada during good weather. Any other questions? So one more thing I'm going to add is that the final live webinar in this series is going to be focused on overcoming barriers. And I know that Beto mentioned a handful of different barriers to screening, but we really want to look as a group at having kind of a roundtable discussion on the different barriers that patients face, and also barriers that you as community health workers might face in getting patients to get screened and in working with your teams. So if you have any specific barriers that you would like to discuss, whether they're barriers for your patients or barriers for you, please be sure to send them in to us so that we can include them in that roundtable discussion. We're going to see if we can find anyone that can answer some of the questions that you may have, and really make that a good, robust discussion. One more update is that the Mammal Van will be at Northern Nevada Hopes February 28th and March 1st, so coming right around. Really, it's a great opportunity to deliver that health care to your clients in the same place that they're used to going to get their health care, if you can get the Mammal Van there. So it looks like we don't have any other questions. Beto, did you have anything final you wanted to add? All right. Well, that is the end of today's webinar. The post-test is already posted on the cancer screening modules page. So if you would like to complete that while everything's still fresh in your head, I suggest it. I made it easier this time. And if you have any questions for Beto, his contact information is here on the screen. Thank you so much to everyone for joining us, and have a wonderful afternoon.